Hi, I'm Dr. Sarah Lai, and I'm a specialist in pediatric dentistry.
What would we do for extreme anxious little patients?
If the child is particularly anxious, we will start with very simple procedures such as cleaning the teeth or maybe applying topical chloride gel just to acclimatize the child to dental treatment. However, certain children might still be extremely anxious even after certain simple procedures. And if they happen to have a lot of dental decay or they're in pain, unfortunately, we might have to consider less conservative methods such as sedation, definitely an option for children who are particularly anxious. Involves the child being monitored by the anesthetist. The child will be asleep whilst the dental treatment is being done. And commonly, we do this for children who have multiple carious lesions in the mouth, which are causing pain and discomfort, as well as the child extremely fearful and anxious of the dentist. This is done so that the dental treatment can be done more ideally and safely because we are doing a lot of fillings and a lot of restorations or perhaps even pulp treatment. We would need the child to sit still and be still during treatment so that proper treatment can be done. General anesthesia is typically done in a hospital setting with an anesthesia team, and commonly the child would be completely unconscious and would need to be intubated for assisted breathing. This would only be done in a hospital setting. So in a clinical setting, they typically just do IV sedation under monitored anesthesia care by the anesthetist. It is a very safe procedure because the vitals are being monitored during this period. The duration of the sedation is only for as long as the dental treatment is required. Of course, we will assess the child's medical history as well as medical condition prior to during the sedation to see if the child is suitable for the procedure.
How does the sedation procedure look like?
So on the day of the sedation, the child will typically need to fast for a few hours prior to the procedure. When they come to the clinic, there will be a pre-anesthetic check by the anesthetist as well as a pre-dental check by the dentist. And once we're ready to go, the child will come into the procedure room. They will breathe in some gas, which will help them fall asleep. Only after they fall asleep, the anesthetist would then administer the intravenous sedation drugs so that your child can be as comfortable as possible. The duration of the procedure depends on how many teeth need to be restored and how complicated the procedure is. Once the procedure is done, the anesthetist would then reverse the sedation and wake the child up. And when the child is awake, the child will then need to rest for an hour or so. And when he's well, he can then go back home. So this is a day procedure. Quite often, this is done for children with a lot of dental restorations because this cuts down multiple visits to the dentist, and it also potentially cuts down many injections of local anesthesia, especially if many of the teeth have deep decay in the mouth. Because quite commonly with deep decay, we would have to give some local anesthesia to the area to numb the area whilst we are treating the teeth. So sedation would be able to make the child as comfortable as possible whilst we treat all the teeth in one go. Quite often, for children who require pulp treatment in crowd, they will need local anesthesia. And for children who are particularly anxious, administering local anesthesia as well as doing pulp treatment in crowd on the dental chair will take not only very long, but will also be very stress-inducing for the child and for the parent. It will also potentially be very dangerous, especially if the child is struggling during the procedure, as we use a lot of sharp instruments as well as the dental drills and a lot of water to clean the teeth. And so for these cases, if the patient is struggling and very anxious, we would definitely recommend sedation because the patient will be monitored by the anesthetist. The patient will not be moving, and dental treatment can be done more ideally when the child is not moving. In conclusion, dental anxiety can be definitely managed at the dental clinic. We have many different types of techniques and ways to deal with anxious patients in the dental clinic. Parents are advised to bring their child to see the dentist even if the child is anxious, as we would be able to make them as comfortable as possible, give them tips to look after their teeth at home. Hope the sharing today is useful, and thank you for listening.